Welcome to my podcast. In this station, I will talk about a common case which is seen in the clinical setting. It's headache. So whenever you encounter a case like that, after you introduce yourself, double check the patient name and date of birth and the address. You will tell the patient what brought you today to the clinic. Can you tell me more about the issue bothering you? So the patient will tell you, I'm having headache, which is intense, or it's affecting basically the performance of the affected patient. So we'll ask, can you describe this headache for me and what about? And if the patient can point out with their finger in the area affected, if it's frontal, or if it's temporal, or if it's occipital, and if it's associated with eye or sight problem, like if the patient say it gets worse in the darkness, and if it has any watering of the eye, or if there is redness of the eye, or flashes, all of that could point out to glaucoma, acute angle closure. Or if the patient says it increases with mastication or eating or combing, so this could point to temporal arthritis. Also, if the patient said that, and in such situation, possibly the patient will be in acute stage if they have fever, vomiting, photophobia. They can't tolerate any bright light. If they have any rash, and when you examine them, you'll find neck stiffness. So all of that could point to meningitis. Also, you need to rule out in that situation, which is basically acute as well, subarachnoid hemorrhage. However, it won't be associated with fever. Also, if the patient tell you that the headache, it's mostly in the morning and associated with the vomiting, which usually projectile. So this could point out to space occupying lesion. Another thing you could ask if there is any aura before getting the headache, and if it's one-sided, and if it's recurrent, or if there is any family history. So in that situation, you could think of migraine. And also another one, if the patient says, I'm having epiphora or watering of the eye, and it comes in one side, and this could be associated with third eye. So this could be as a differential cluster headache. If the patient says, I just feel it like a band or a tension around my head on the temporal area and increase with stress, it could be pointing out to tension headache. Also inquire about any sight issue. Say, for instance, if the patient is wearing eyeglasses, or have issue with the reading, so possibly you need to be seen by optician or sight specialist to correct the error they might have. So basically, you need also to ask if there is any recent history of trauma like for instance, in old age, they might have cumulative trauma, which could lead to subarachnoid hemorrhage. So all of that should be addressed. Also, you could ask about if they have flu-like illness. Maybe it's related to cold or flu, or any neck problem, or could be related to bad posture, or skipped meal, dehydration, alcohol as well. So all of that should be covered in headache, basically. As I say, you ask the patient to point their finger where basically they feel the pain and could describe the intensity and the characteristic of the pain, because each of the differential I just mentioned have a characteristic feature which could point out basically to the kind of headache they have. Also, not to forget about alcohol hangover. So patient could have drank a lot, and next day, or if it's a frequent thing, they will have a severe headache. And in that condition, they might feel slurred speech, trembling, feeling cold, and they lose the judgment as well, and it could affect, of course, vitamin B6, and some of the vitamin B deficient. Also, not to forget about in certain situation when patient they have headache, they might take a lot of medication, so this could precipitate more headache. So you need to ask about medication because it could be medication triggered. So after basically ruling out all of that, you need to ask the patient if they can have like a diary for the triggers of their headache, and advice about some relaxation and breathing technique they can do in order to overcome the headache, and ask about their lifestyle. They could change some of their lifestyle and eat healthy as well, and avoid too much medication, only if needed, under the instruction of their GP. So all of that should cover headache, generally speaking, and you will treat basically according to the differential that you felt it's more appropriate for the case you were seeing. Like, for instance, if it's giant cell arthritis or tubular arthritis, you will send for ESR, and should be treated immediately with high dose steroid. If it's, for instance, migraine, you will need to treat it accordingly if it's proved to be migraine. Also, if it's, for instance, subarachnoid hemorrhage or meningitis, needed to be treated as well. If it's in the GP, you will give the injection. And if it's in the emergency, there is another antibiotic you need to give, which is the third cephalosporin, third generation. If it's trauma, of course, you will send for CT scan to rule out any hemorrhage. If it's glaucoma, needs to be treated as well and referred immediately to the ophthalmology. So by that, I hope that I covered the main points of tackling headache, and accordingly to the patient presented history, you will treat it with a management plan that you need to agree with the patient after asking the patient their thoughts and ideas about what might be the reason for their presented symptom. Thank you.